you need that patient down to their underwear because it's going on over their underwear, but under their shorts. Okay, for the purposes of practice, we're not going to do that. So for when you guys next week or 2 weeks come back, those of you who have like tight shorts or really short shorts, bring them because it's easier for your partner. The guys is going to be harder. You guys have those really long shorts. Like, find your shortest short, okay? Because it's going to get kind of annoying, okay? So what we want to do with your Hip Spica, the whole point of the Hip Spica is to get that suction back up. Okay, it's going to pull the femur back up into the hip socket so the patient doesn't have to work so much with their muscles, which might be injured. Probably there's a hip flexor strain or an adductor strain. So what we want to do is let the Hip Spica pull the leg into flexion for you, kind of like the plantar flex assist did for your Achilles. It helped give you the springboard. So we're going to create that external support. So what I'm going to have her do is we're going to use this leg. Good. She's going to put that leg as far back out of my way as she can. Great, perfect. Now, try not to turn so much though, yeah, and maybe bring that foot a little closer. Great. So what I want to do, typically under a Hip Spica, because you're doing it, maybe there's a hip flexor strain, this unload would be higher. It would be at the hip flexor. Or maybe there's a high adductor or a high hamstring. So we can have a quad strain that still she's having trouble with hip flexion, right? So I'm just going to leave this here and show you what it looks like combined. But imagine if that's maybe shorter and it's up here, that could be also what's under your Hip Spica. So you're going to have 6-inch ace wraps with these claws. We don't use the claws except to kind of hold them together. We never put these on the athlete because God forbid someone got smushed and it dug into their skin. We don't use those anymore, not with light plast and leukotape. So what we're going to do here is we're going to start. You're going to see tons of tension out of this the ace wrap. So what we want to do is, if this patient has a problem with hip flexion and they have pain with external rotation, we don't want them to go to external rotation. So we're going to slightly internally rotate their foot a little bit, which is going to block that motion from happening, okay? So from there, the other thing that could be, maybe they've got a pinch in their groin when they come up and they don't like internal rotation and flexion. So I'm going to open them up into hip external rotation to tape them. So let's say that's the case for this one. We've got a pinch in the groin, right? So I'm going to start kind of at the midpoint of her thigh, and I'm going to come around the thigh, and I'm going to wrap twice around her thigh, getting as high into her groin as I can without it rolling. Twice around. Now I'm going to come and I'm going to pass it behind her along what I think is her SI area. And I'm going to give her a nice little squeeze in there, twice around, if I can. And then I'm going to finish. This is what the most important step is that you finish coming up around the leg. And then I need her to hold that in place for me. Because now to keep it there, I'm not going to use those little jaw clips. I'm going to use light plast.
What about for people who are larger than Tammy?
Then you're going to go maybe once around, and back once around.
Okay.
Or you're going to go twice around, once around, and get back down around with whatever you have left. Okay? Then what we're going to do is the same way you just did that. Don't let go completely. Now you can move, yes. Here we go. I'm going up into her groin. I've caught now that spare leaf of the rest of the ace wrap. Here we go. Up, pass it, pass it. Now the most important part, we come back down. And then I finish laterally. Okay, and then I would close with some Leukotape. Now, this again, you would finish with lube and lube, unless she doesn't touch or she's wearing tighter shorts.
So they can put like spandex over the hips.
Exactly,
Okay.
yeah. The key is you have to make sure she used the bathroom before you did all this, okay? That's the reality of this. But an athlete who, an athlete who really needs hip flexion needs a hip spica. If the injury is solely to the rectus femoris, you don't need the hip spica. You just need the unload and the wrap. But if you've got hip flexor issues, you're going to have to go up around the pelvis because the leg can't hip flex without that pull. Do you understand? So if the injury is solely to the thigh, you would do just the wrap I showed you before. If it's the hip flexor, you need to go and grab the pelvis because the leg can't get up any other way. Make sense?